If you're taken ill and need to stay overnight at your local hospital, don't be surprised if you're shipped off to the nearest Bupa. More than 350 hospital beds have been axed in Greater Manchester over the last 2 years. Now some hospital trusts say it's cheaper to turn to the private sector.
The care these patients receive in the private sector is very good, and the NHS wouldn't be transferring patients to the private sector if that wasn't the case. It's just that the on-cost, the cost of the buildings, the cost of the staff, don't need to be borne by the NHS Trust for that short-term period that they require the additional capacity.
One of the explanations being offered is that we tend to experience shorter stays in hospital these days because modern medicine has become so much more effective.
There is a drive towards getting more care provided in the community, which reduces the necessity for hospital stays.
But what happens when a real epidemic hits, like the recent winter vomiting bug or even bird flu? How will such a lean NHS cope then? Tameside Hospital Trust has axed 111 beds over the past 2 years. Pennine Acute Trust has cut 160. Central Manchester and Manchester Children's Hospital Trust has axed 48. Trafford Healthcare Trust has axed 30 beds. Bolton Hospital Trust's 45 beds.
I think we have to be wary that we can't keep on cutting beds, otherwise we're going to run into big problems, particularly if we have, for instance, a flu pandemic, which so far we've been able to avoid again this winter, but at some point it's going to hit, and it will hit hard because we have less beds in the system.
It is a daunting prospect to think that you or I could be turned away from our local hospital because there aren't enough beds. But it seems that's what trusts have to do to get themselves out of this financial hole. Beverly Walkden for Channel M News.